Hello, sir.
Yeah, hello.
Sir, I have made you the co-host, sir. You can start the class, sir.
Pardon?
I have made you the co-host, sir. You can share the screen and start the class,
Okay.
sir.
Thank you.
Mm.
So, hi everyone. Hello. I hope all of you are fine. So, guys, this is our first session on the genetics part. I hope you guys enjoyed the embryology part, and today we are going to deal with the part on the embryo, on the genetics. Okay, fine. So, I'm Dr. Ankit, your anatomy educator on our Auricle platform, and today we'll dealing with the various parts of molecular genetics and some inheritance patterns as well. And it's going to be beneficial for the university exams as well as for your various PG exams. And you can use the code for various discounts on our subscriptions. These are all the type of questions which can arise from genetics. Normally, in university exams, one question is allotted to the section of genetics, put from 5 to 10 marks. And obviously, questions are do asked in the Viva OC. Plus, in MCQs also, questions do come from genetics, and genetics is not a separate subject. It is actually quite linked to the pathology, to biochemistry, and to other medicine parts. So it is helpful for your future subjects as well. Okay, guys. So why to choose Oracle? Here we have all the benefits of choosing Oracle, and we'll see them in detail later on. What are all these benefits? And one thing over here, these are the types of subscription, and you can use the code below for getting some discounts. And I would urge you all to take a screenshot again of this so that you have idea what is being offered to you at which good price. Fair enough. So let's move to the topic of genetics and how we are going to proceed it. Let me first of all clarify that small part on how we are going to proceed. So genetics wise, we are going to proceed in the form of two different lectures. So there's going to be two lectures which are allotted to the genetics part. Okay, today is the first one. So let's start this, and today we are going to see for the polls as well. So look at the questions carefully, or meanwhile, I'm thinking to start with the poll itself, right? Just a second. Let me move it a bit. Right. Okay. Fine. So guys, I hope you can see this question. So we are going to start with first question, and the time has already started. I hope if you want to give the answer, you can. And we are giving this approximately 1 minute for this question, and you can see the question. If yes, I can also read it out for you. Let me just enlarge it a bit. So the question goes that which of the following is directly involved in the regulation of gene transcription? Okay, we have the options like ribosomes, and then we have promoter regions, we have Golgi apparatus, and we have mitochondria. Okay, so these are the four options, and take your time of 1 minute, even if you can think of the answer, and then the last few seconds you can mark. Single choice, so only one option is correct, because we in the beginning it took around 10 seconds. We'll have 10 more seconds over here. Again, options are ribosomes, promoter region, Golgi apparatus, and mitochondria, and which is directly involved in the regulation of gene transcription. Okay, so yes, guys, time's over. So answer for it will be our this option number B, that is a promoter region. Okay, let us see that also. Promoter region, how it's going to help us. Just a second. Okay. Right. So answer for that will be the promoter region. We'll discuss in detail, but yes, come to the lectures. The main topic over here. Let's start with heredity, and let's do some basic review over here. See, guys, the topic of genetics is such that most of the things we might have seen or discussed in our school life. So yeah, it would be sort of, we can say, a quick revision for most of us. So heredity, let me start. Process of transmission of characters from one generation to the next generation. We all know about this. Point number one. The characters are determined by genes, and genes are located on the chromosomes, which have the DNA and all that. Individual receives genes from both the parents. So that we discuss in our embryology also, the fertilization, the gametogenesis, okay, meiosis one, meiosis two, and transmission of genes follows some statistical laws. Okay, genetics over here. Let us just try to define the genetics. Genetics is a study of genes and the statistical law that govern the passage of genes from one generation to the other. That is genetics. Okay, fair enough. Branches of genetics, just to overview that for some of you might be thinking of their future career in this whole subject of genetics, because let me tell you, apart from all this theory and all, the future of the science and all is, I mean, it's not just future, presently also it is going at a much big pace, and obviously future is dependent. So it has many branches, like you can see the cytogenetics over here, okay, where we have basically deal with chromosomes. We have molecular genetics, the study of chemical structure of genes at a molecular level. So that is also quite interesting. We have developmental genetics, genetic control of embryonic development. Again, very, very upcoming. We have immunogenetics, again, for the different type of antibodies. Behavioral genetics we have on behavior of individuals. So you can imagine how the genes play a role in behaviorism also. That is connected to even the psychiatry, a lot of personality disorders. Population genetics, frequency of genes in human population, the rate at which they mutate. It is at a bit much bigger level of the changing the whole demographies, and so many implications are there. We have biochemical genetics, where metabolic process at each stage are controlled by enzymes whose production is under control of genes. This branch deals with the inborn errors of metabolism. And if I may ask you, there used to come as a question that who is the father of inborn error of metabolism? It used to come in NEET UG, and the scientist was Archibald Garrett. Okay, Archibald Garrett was the name of the scientist. Just Archibald Garrett. Okay, ARCHI, Archibald Garrett. And there's also cancer genetics. We all know in medical line how important oncology is right now, both oncosurgery and medical oncology. We can imagine how important is cancer genetics. Let us see some points of it. So it is observed that 50% of the first trimester abortions are due to the chromosomal abnormalities. So that is a statement from your Robson Gynae. Then we have congenital malformations of genetic origin are seen in 2 to 3%. So you can imagine the prevalence of the genetics and the role of genetics. More than half of the childhood blindness, deafness, and mental retardation are due to genetic disorders. Just imagine more than 50% of the childhood blindness, deafness, and mental retardation are due to genetic disorders. Okay. And this also is seen more in people who have consanguineous marriages in the same household, in the same genes, and also in those areas also where it is a common practice. It is seen that the ratio of genetic disorders is has increased a lot, and even that has implicated the governments to slightly promote non-consanguineous marriages so that you can allow your younger individuals to marry outside your core family or outside your immediate relatives. Okay, so that has become a problem in even the countries as well. So remember that also. More than 5% of the adults suffer from disorders which have genetic background. Just imagine more than 5% of the adults. Imagine 5% of the entire population. Many common cancers have a strong genetic component, as you will study in pathology in medicine. It will come to play a role also in biochemistry as well. Now, let us review our brief knowledge of chromosomes. There are 46 chromosomes. We all know we have 22 pair of autosomes and we have one pair of sex chromosomes. So it is either your 44XX or it is 44XY. So that is total of 46. It is female 44XX and 44XY will be a male. It will be a male over here. Okay, now secondary constructions. This is the centromere over here with the two arms, a long and a short arm. I hope you remember the P and Q is to study. The long arm was the Q1 and the short arm was the P1. The short arm was the P1. Okay. Some questions which used to come and will also come are the different, the way the centromere is located depending on it. The chromosomes are either labeled as metacentric or submetacentric or acrocentric or telocentric, depending on the location of the centromere over here, which divides the whole chromosome into different bands. Initially, yeah, they also used to be a very famous question of X and Y chromosomes. So remember that X chromosome is acrocentric. Okay, X chromosome is acrocentric over here, and the Y chromosome is submetacentric. The Y chromosome is submetacentric. The standard classification, there's a Denver classification as you can see over here, and all the pairs of chromosomes, the 22 plus XY are shown over here. You can see the X and Y as we discussed, submeta, and your acrocentric. There's also a Paris nomenclature. You can take the screenshot if you wish to, that might help. Now, karyotyping is very important. So, chromosomal analysis, obviously, that forms the base of the entire genetics. So, chromosomal constitution of an individual. Okay, there's a whole, if you remember, the Human Genome Project used to started around 1990, and it took around, I guess, 13 or 14 years. It ended in 2003 or 4, something like that. So that was a whole Human Genome Project which was done. And the rapidly dividing cells, these are the sources of rapidly dividing cells which can be taken. Okay, from there. Okay, so here we have another MCQ, right? Let's discuss this. So correct answer for this question over here was the promoter region over here, right? That was the correct answer for option, the question number 1. Let us see the question number 2 over here. Okay. So question number 2, we have the question over here, the lac operon. The lac operon in E. coli is an example of what type of gene regulation? Remember the lac operon, the lac for lactose, single choice. Options are post-transcriptional, then transcriptional, then translational, and post-translation. These are the 4 options. I repeat the question. The lac operon in E. coli, Escherichia coli, is an example of what type of gene regulation? So what do you think is the answer? Again, we'll have around 1 minute. And I guess the timer has been started, else I will use the timer. Just 1 second. Let me start it on my own. Just a second. Okay. Okay. Fine. So same question. Lac operon in E. coli is an example of what type of gene regulation? The answer for this will be option number. I guess the time is over. Let us see if any one of you did attempted. Okay. Answer was our option number B, that is a transcriptional. Okay, transcriptional. Do remember there are various negative and positive inducers. The lac operon is one of the negative inducers, right? So it is LSE left for lactose, and that is mainly useful for transcriptional things. Okay, transcription. So when there is lactose, it turns on, and if there's lack of it, then obviously it turn off. So basically, this whole is helping for transcription of the gene. That is what the lac operon is doing for the E. coli. Okay. Fair enough. So, okay, so we are here. Let us move. So this is how the venous blood is taken. So you can see the whole rapidly dividing cells, lymphocytes from peripheral blood easily taken, fibroblasts, bone marrow, and this is just an image. And this whole flowchart is given over here. I urge you to take the screenshot. Just read it for 2-3 times. You take some venous blood, you separate the cells, you add a culture medium, you add colchicine and separate the white cells. And then you add hypotonic saline for a drop, and you start do the karyotyping. Now that is easier said than done, but yeah, at least basics you should know. Then this sort of karyotype that comes out. An ideogram will be a diagram which represents the karyotype. What we are seeing is the ideogram over here. It is a diagram which is representing the karyotype. Now, why do we do a chromosomal analysis? That is also quite important. These are all the factors, the reasons why you do a chromosomal analysis. It is indicated in congenital malformation. So we can understand just by looking at it the uses of the chromosomal analysis that is used for the congenital malformations for just a second. Yeah. For mental retardation, for repeated abortions, for sex determination, and prenatal diagnosis. Now you might argue, sir, in India, sex determination, we don't see that is a different thing altogether. There is not the same thing around the world. But yeah, it is helpful in all of this. So then there comes a bending. Now this is one of the, you see, in university exams also one of the good questions, and also in your MCQs types of bending. So at least remember that there's a G bending, there's a Q bending, there's a reverse G bending. So just have some basic idea that G bending is most commonly used, and it is due to this light and dark bands are being shown over there. The Q is for the quinacrine, and quinacrine mustard is being used similar to G bending that observed under a fluorescent microscope. This is a bending pattern which just discussing of the individual chromosomes, just an image so that you have an idea of it. Then there's R bending, I said the reverse of G bending, and C bending. These are the types of bending. Okay, let me show you one more question over here, one more MCQ over here, guys. So, okay, this is the MCQ question number 3 over here. Just try to answer it. I will read the question as we're discussing the Human Genome Project. So, which of the following? The question is, which of the following is not or was not a goal of the Human Genome Project? One of the biggest projects ever taken. Option A is identifying all the genes in human DNA. Option B is sequencing the entire human genome. Option C is finding cures for all the genetic diseases. And option D is determining the function of genes. So, which is not a goal of human genome project. So, I guess you can remove two options, then confusion might come. You can use your common sense also. Take some time. Okay, I guess the time is over. So yeah, you can see the Human Genome Project was basically to identify all the genes in human DNA, then sequencing them, and also determining their function. Now, how can it determine the cure before you even know the whole genetic framework? So obviously, answer is option number C. It was not meant to find the cure. And that was a later on project, but not at the time of the when the Human Genome Project was at its peak. So answer for this question will be finding cure for all the genetic diseases. It was not a goal of Human Genome Project. I do remember this. Okay. Right. So let us come back to this bending. After bending, there's also a new thing known as a fish that will study more in detail in your pathology. That is fluorescent in situ hybridization. Very new diagnostic technique. Not that new nowadays, but yeah, even it is quite recent. So ssDNA, single-stranded DNA probe has a unique ability to anneal with a complementary target sequence, and then actually the thing is it comes in a very beautiful images that you will see more in your pathology books once you reach a second year. No pathology. There's a famous Robbins pathology. Beautiful images are shown over there for the fish. Those fish images, the fish technique over here. The site where the probe hybridizes with the complement DNA, so widely used in clinical diagnosis. That is why it is important. So you should have some basic idea what is this fish over here. At least even in we remember in our Viva was some examiners even used to ask at least tell the full form of fish, FISH. It is fluorescent in situ hybridization. Okay. This is a normal female. You can see the different color coding over here. The spectral karyotype of a normal female, XX chromosome over here. Yeah, one more important and a small thing is Lyon's hypothesis. Lyon's hypothesis, Barry F. Lyon was demonstrated this hypothesis, and this hypothesis says that during early embryogenesis, that is in 15th to 16th day, that is the initial third week of development, one of the two X chromosomes becomes condensed and inactive and forms a bar body. So one of the two, so there are two X chromosomes, one of them, so there are one X, one X. So one of them will become inactive and it will form what? Form a bar body. So I hope you all know that in which sex is XX found. It is a feature of female. So in female, one bar body will be present in normal female. The process of X inactivation was given by this name as lionization. Lionization. Features of lionization. So features over here, just a second. Yeah. So obviously one of the two is becoming inactive. Occurs early in embryonic life. So in initial around third week, we can say. X chromosome is chosen at random. In some cells maternal and some cells paternal X chromosome. So it does. So if there's a female of X and X, we don't know. There might be a question. It is a mother X or the father X. So in some maternal and some paternal. So it is not fixed. Okay, the only maternal or paternal X chromosome has to be lionized. So once a particular X chromosome has become inactive, same is inactivated in all daughter cells. So once one is inactivated, all. That is lionization. Very important. Short thing, a short question can come. Every female is therefore a kind of mosaic with respect to genes present on X chromosome. This is a very good tough statement. Do remember this. During mitosis, the inactive X chromosome is late left replicated. Just a feature. The number of bar bodies, you can see over here, the number of bar bodies is always less than the number of X chromosomes. Obviously, we have two X chromosomes, so bar body will be only one. So one bar body is a normal female and none in normal male. So in males, there should not be any bar body. Now the questions used to come, as you can see below also, some clinical features. Name an example of a type of male who might have a bar body. That is your Klinefelter syndrome male. So Klinefelter syndrome, even if there is one Y, we call it it is regarded as a male only. But in this, there's X and Y, XX and Y, so there will be one bar body present. Remember. And then there will be question like, what is the type of female which has no bar body? So that is going to be Turner syndrome over here. Again, question. These are all the questions. What is an XO? So there's only one X chromosome active. So there's only one X chromosome. So it has no bar body. Normal male and female, we all know male has no bar body, female will have one bar body. So these are the type of questions. Female with no bar body is Turner syndrome, and male with bar body is Klinefelter syndrome. Simple as that. Okay, now let us see some chromosomal disorders, and before that, let us see one more MCQ. I hope it might be interested over here. So we have done third one. Okay, let us see one more. Might be simpler one, I suppose. So genetic linkage occurs when? What is genetic linkage? Now apply common sense also. Two genes are on the same chromosome. Then we can regard it as genetic linkage. Two genes are located far apart on different chromosomes. That is second option. Third option is two alleles are dominant. The alleles are simply some sort of, we can say, variation of genes only. And fourth option is two genes are located on sex chromosomes. What is genetic linkage? Take your time, take 30 more seconds, try to answer. Think, not the difficult question. Right. Okay, so genetic linkage, it is the two genes are on the same chromosome. That is option number A will be the answer over here. Option number A, two genes are on the same chromosome will be the answer. Okay, so this will be the answer over here, option number A. Right, correct answer is A. That is genetic linkage. That is what he says, sort of, you can say a straightforward question, not that difficult, I suppose. So that is very important slide which is coming up in front of you guys. That is chromosomal disorders. Okay, chromosomal disorders, guys, are three different major types. Disorder in the chromosome number. The number itself has entirely changed. Disorder in the structure of the chromosome and different cell lines are there. There are three broad categories to identify, to talk about the chromosomal disorders. Either their number has changed, their structure has changed, or there is a different spiritual cell lines are fall apart. Chromosomal abnormality is responsible for significant. We all have seen that more than 50% spontaneous abortions in the first trimester, up to 1% congenital disabilities and malignancy. So this is just to tell you the implication or the magnitude of the effects which chromosomal disorders have. Okay, and nowadays it is mandatory in all the hospitals. I don't know how much in India, but yeah, it is in government hospitals. Hospitals we have seen that they take all this when a child is born, all the genetic for the chromosomal disorders, it is checked also. So that is, I mean, in Western countries, it is quite common. It's quite common to check in all the newborn child. Disorders and chromosome number. So there was number structure in different cell lines. Let us start with the number. So individuals may have more chromosomes or less chromosomes. A cell with a missing would have 45 monosomes. So you can understand the whole number has changed. Simple as that. Some terminologies how we use it, like we have Down syndrome, we have so many Patau syndrome, all that. So when a cell has three chromosomes instead of two, we have trisomy, right? Trisomy 21, trisomy 18, and trisomy 13, all that. So more than more than the normal number. If four copies of the same chromosome, we have tetrasomy. Tetrasomy of autosomes is rarely seen, or it's not known in humans. So when this tetrasomy, it is normally seen in the your not sex chromosomes only. Tetrasomy sex chromosomes is observed over here, right? Another type of numerical abnormality is polyploidy. So one was that trisomy, tetrasomy, one is this polyploidy. Number of chromosomes in the somatic cell increase by one or two sets. So this whole increase in the set of what of the somatic cells, increase in the set of the chromosomes. Haploid is a complete set, has 22 autosomes and one sex chromosome. That is haploid. Normally we know it's diploid, right? It is haploid when we have a set of 22 autosomes and only one sex chromosome. Then all human gametes are only haploid. We discussed that in our fertilization part of the first lecture of embryology, if I remember. Guys, we have done the around 5 lectures of embryology. Do look at that too. Somatic cell has two haploid cells, diploid three, triploid, tetraploid, 69 to tetraploid 92 are unknown in human, and the results in spontaneous abortions. I guess we have seen the meiosis or meiosis, whatever you can call it as, MEI is over here. So meiosis 1 and 2, that is a normal gametogenesis, as you can see over here, how from when the four gametes are formed. Now this failure of separation of homologous chromosomes during meiosis 1 only. So that was meiosis 1, that was meiosis 2 over here. So when they don't separate, it is this factor, and then when it happens in meiosis 2, it is right below in option number in table number C over here. During spermatogenesis or genesis, abnormal gametes might form. Failure of homologous pair of chromosomes to separate is non-disjunction. Homologous chromosomes have to separate, as you can, as you seen in this previous image, they are not able to separate. So that is known as non-disjunction. Okay, occurs in meiosis 1, may occur in meiosis 2. So it means statement more seen in meiosis 1 than meiosis 2, the non-disjunction of the gametes. Mosaicism is another term, then this whole cell lines, the two or more different cell lines are observed. There can be structure problem, number problem, and the whole mosaicism may be there. Non-disjunction can be in a developing zygote where cells are. We all know that in embryology we have seen that how the cleavage division occurred, morula, and then there's rapidly dividing cells. No, so it is commonly seen like that. The causes. What are the causes of non-disjunction? What are the causes? So non-disjunction, I guess we understood. Just remember this image at least. More seen meiosis one, then you will understand non-disjunction. Sometimes see a picture says 1,000 words or 100 words, whatever you can say. So it is quite important for anatomy, subject to anatomy, that a picture says a lot of words. So focus on pictures, see them, understand them, observe them, look all the points, and you will get the hints from the picture. So what are the causes of non-disjunction advancing maternal age? So normally after 35, 40 years, one of the most prominent cause, radiation during pregnancy. That is why when as a clinician also he writes a investigation like an X-ray or CT scan. It is in a young female, normal fertile female in the age group of say 15 to 40, 45. It is asked the female that we are pregnant or not, right? Because radiation causes one of the most important. And even the radiologist or the technician who is doing these procedures, they will also ask, and they it is only if it is very important, only then it is advised for a pregnant female, else it is avoided. Delayed fertilization after ovulation, or it may be genetic also. Non-disjunction itself may be genetic. Now, numerically autosomal abnormality. Numerically, remember in number, this is number one. As I said already, commonly observed, this is Down syndrome, that is Edward and Patau syndrome, just the names. But these are the trisomies. Okay, other trisomies are also there, but they result normally in spontaneous abortions. Now, Down syndrome. Now, questions do come from here, guys, straight on, and I am sure you must have heard of this Down syndrome, quite common, and there are a lot of societies which are upcoming, I mean, which are there in India also. You see a lot of Down syndrome children. Even we have different schools, we have especially able or schools for that, different societies for that. Even in most of the mass media, we look at them in your television media also. We see a lot of Down syndrome. And once you start seeing them, it is easily recognizable. Okay, just by looking at the Down syndrome. So it is quite common. Just imagine 1 in 700 births, and in a country population like India, you can imagine how many number would be there. It increases the advancing maternal age at 45 years. So incidence as high as 1 to 16. Just imagine. Okay, males are more affected than females. Down syndrome, these are the various features. Guys, this should be at the tip of your tongue again. Again, a picture says 1,000 words. You'll see the picture also. But a mental retardation is seen, flat occiput and nose. So it gives a mongoloid type of faces over there. Middle epicanthus, low set ears, high arch palate, protruding tongue. You can see the mouth is open and the tongue is slightly protruding out. Clinodactyly could be there. CVS defects, hands short and broad. So we're looking at hands also. May have a single semen fuse. Normally we have two pieces over here, and they might have a single semen fuse. Right? These are features, and this is just an image over here showing some folds, protruding tongue, mouth a little open, flat nose. As this child will grow up, then obviously the changes are seen more rampant. And do remember, these are all facial things, no? But remember the CVS defects. That is the one which, as a clinician, as a doctor, you should know that. Okay, but if I'm seeing a child of Down syndrome, I should take a history of the CVS. I should put my stethoscope and listen for any defects or not, right? So do remember that. Okay, simian is Down syndrome, you can understand. And there's a karyotype, you can see trisomy 21 over here, right? So Down syndrome may be by the following abnormalities. Trisomy 21 most common. Genotype is either this, and mainly this is what we have seen due to non-disjunction or meiosis 1. Do remember all the features and try to make a faces over here and try to make the karyotype when the question comes of Down syndrome. It is one of the most common questions that come in university exams. Okay, fair enough. Just a second. In 3% is translocation, Robertsonian. We'll see what it is later on. Children with mosaicism have two cell lines, normal and trisomic. Lifespan, yeah, very some few weeks to decades, 20, 30, second or third decade. Mean is around 16 years of age. Suffers they later on they suffer from Alzheimer's as well. The recurrence risk is 3 times more for subsequent child to have Down syndrome. First child is Down syndrome, there are more chances that second may also have. In translocation, if carrier is father, the rest you can see the effect of genetics over here because always the parents are involved over here. counseling. So this is again all clinical amniocentesis, triple test. There are three biochemical markers. Don't worry, this will be tell to you detail in your gynae and all. But yeah, in a first year, you should at least know what is all that, so that when you have heard of this test as well. So triple test, you have three things which are checked: alpha FP and Austrial and CG, HCG, gonadotropin are checked at around 16 weeks of gestation. Patau syndrome. Before going to Patau syndrome, let us see one more MCQ and just take a small uh, refreshing idea over here. Genetic linkage we did. Alleles. What are alleles? Alleles, as we discussed, they are one of the four options. The first option is they are variants of gene. Second option is they have different chromosomes, right? Third option is they have identical copies of DNA. Or fourth option is that they are regulatory proteins. So what are alleles? Alleles are, okay, your time guys. Oh, right. Think. 10 more seconds. Not the difficult question, I suppose. Okay, so alleles are, as I guess I also said it in discussing some other topic, they're actually simply variants of gene only, nothing more. They're not different chromosomes, not identical copies of DNA, and not of proteins. They are simply variants of genes, and that is what is the definition of an allele that we'll see. So now Patau syndrome, trisomy 13. Should know this. This is also second common question you can say after Edward, after your Down syndrome, or Patau Edwards. So again, these are all the basic things. Most die within 1 month, so not a good survival rate. None survives more than 3 to 4 months. So obviously, you are not going to see children with Patau syndrome. Most lead to spontaneous abortion. Incidence is 1 in 5,000. These are all the features. And just remember the 3 4 months children, small skull eyes, may have cleft lip, malformation of CVS, CNS. So simple genetic change, and you can imagine how the entire functionality, abnormal anatomy and physiology of the body changes in a developing embryo or developing child. This is a Patau syndrome child over here, an image, trisomy 13. So sometimes this karyotype is also shown, and just look at 13 or look at 21 to diagnose it, or look at these X and Y if there's some other problems are there. Genotype counseling, okay, trisomy 13 already seen, and then comes the 18, that is Edwards syndrome. Again, most result in spontaneous abortion, 1 in 6,500 births. Early death again, long-term survival may be there, so it is rare. Look at the clinical features. Retarded growth. So I would advise you to make a table of Down, Patau, and Edward of clinical features. First column Down, then Patau, then Edward. Simply, and then look at the commonalities, look at differences. It is just a 10-minute work for you, and then your one question is set. Okay, so do remember to make a table, sort of table over here with a Down over here, Patau over here, and Edward over here, and they all list all the clinical features. So now you know yourself what will be the commonality and what will be the differentiating feature. Okay, one image of Edward syndrome over here, Patau, the Edward, the prominent occiput, small chin, child's hold fingers typically like this in a different manner, Edward syndrome over here. Okay, trisomy 18, as you can see in this 18 number. You can see also the sequence of the karyotype, no, largest chromosome to the smallest one, sequence, decreasing order. Genotype, trisomy 18. Okay, so chromosome number we are seeing. Now you can see the trisomies, monosomy, mosaicism also seen. Turner syndrome, and the common Turner Klinefelter Turner syndrome, we already said, no, a female with a no bar body. Okay, so 20% spontaneous fetuses have this. Incidence is 1 in 5 to 10,000. Affected females are of normal intelligence or slightly retarded, so hard to determine. But yeah, important features, webbed neck. So in the neck, you might see the webbing over there on the sides of the neck. Low posterior hairline, cubitus valgus. Cubitus valgus, cubitus virus, they are actually part of the elbow over here. Okay, so cubitus valgus means that the elbow is more tilted inside, and varus means more tilted outside. Like we have a genu valgum, genu varum for the knees. Similarly, we have cubitus. Cubitus, remember cubital fossa, right? So that is the actually the in front of the elbow we have cubital fossa. So webbed neck, very important feature. Broad chest with widely spaced nipples, another important feature, and short stature. These are sort of females which are normally having Turner syndrome. Okay. Specific defects, arithmetic skills, reading maths, or drawing diagrams may have again the heart problems, abnormality of urinary system. Then they will be sterile females. They have only one X chromosome and with poor menstruation and breast development. So breast development is also sparse. You can see some webbed neck over here, very small child being shown over here. Okay. Again, you can see the remnant of skin over here in this area. Okay, you can see the remnant of skin over here. It is 7 weeks, just newborn. Okay. And you can check over here also in these images. Turner syndrome, we have the puffed feet. It look like having a whole edema. Okay. Bipedal edema sort of. Look over here. So these are would be a straightforward questions. Turner syndrome. Genotype, about the genotype of the Turner syndrome, monosomy X most frequent. So there can be other reasons also. It could be due to these factors as well. So remember that one. Estrogen replacement therapy (ORT) might help over here for development of mainly sexual characteristics, or just estrogen. Few features over here. Triple X females are also sometimes seen, so be prepared for that too. Although very less number of cases will have this triple X females. Clinical features, these are the clinical features, phenotypically normal, IQ is also normal. Second, yeah. Genotype again. And then lastly, not least, Klinefelter syndrome. XXY, male having bar body, male having bar body. And as we reach this, let us do one more MCQ over here. Just a second. Okay. So this was the fifth question, I guess. Right. Let us now do one more. Okay. So guys, so question is that polygenic inheritance refers to traits that are polygenic inheritance. Just look at the word. It refers to traits which are option number A is controlled by multiple genes. Option B controlled by single gene. Option C controlled by environmental factors only. And option D located on sex chromosomes. Polygenic inheritance. I don't think you don't need much time, but it still take 5 seconds. So yes, polygenic inheritance controlled by multiple genes will be the answer over here. Controlled by multiple genes. Okay. So answer would be option number A over here. Just a second here. Okay. Let us move to our discussion of Klinefelter. Clinically, it is the individual is a male, as I told, but yeah. Detected not in the early time, but at an adolescent age, is normally infertile and looks normally tall but mentally retarded. Okay. Secondary sexual characteristics not fully developed. Gynecomastia may be seen in small testes will be there and facial growth are scanty. Very important feature. Small testes, tall boy, secondary sexual characters not well developed. Gynecomastia may be there, facial hair growth scanty. These are all the features over there. So it does remind the taller than average height, reduced facial hair, reduced body hair, breast development, osteoporosis, feminine fat distribution, and small testes over here. So guys, just see all these features are being shown. It is not that it is 100% Klinefelter only. You have to go for the karyotyping and other genetic tests to determine whether it's a syndrome or not. Because some things over here are quite overlapping in a human population like millions and billions over here. I hope you're getting the point, right? Confirmed diagnosis by this whole karyotyping and genetic testing only. You can't label anyone before that. So you can see two X chromosomes and also one Y chromosome over here. That is the Klinefelter. Counseling at the time of puberty obviously gives some testosterone. Like in Turner syndrome, we give estrogen replacement therapy. Here you can give it the testosterone. Okay, then we have XYY males, again phenotypically normal but tall, slight mental retardation, emotional maturity might be there. Okay, and here you have karyotyping of 47XXY. Addition of Y chromosome is due to non-disjunction of meiosis 2 during spermatogenesis. See, this can be a question in itself. During non-disjunction of Y chromosome in meiosis 2, what could be the genotype? Something question like that can be framed. Now chromosome structure, number we have seen now structure. Most common abnormalities refer to chromosomes that have a portion missing or a portion represented twice of breakage of chromosome. Now look at the structure problems over here. I'll just come to the main point over here that, yeah, these are the important abnormalities which are normally seen in chromosomal structure abnormalities. Right? We have chromosome deletion. Just note them down. They are very important for answering inversion, ring chromosome, isochromosome, translocation. Remember, a bird we heard of Robertsonian translocation. Translocation located separately here and there. That is simple translocation. Deletion. So we have this five, six things. Deletion, inversion. So let us start with deletion over here. Breakage occurs, so that is deletion. Simply it means breakage is occurring somewhere. So breakage occurs. Let me change the color to black. I'm still getting bored with this color. So okay, breakage, deletion. Broken part lost as it has no centromere. So there is small breakage, broken part is lost. Part may delete at terminal end, intervening portion may delete. So it is simply breakage. That is deletion. There may be several genes involved or large part deleted cannot survive. A loss of more than 2% can be lethal. Microscopic or chromosomal deletion. So that is a deletion. You can see the deleted part gone. So it is terminal deletion. One example over here, that is interstitial deletion. That is, you can see over here, the one is terminal deletion. So deletion at this terminal part. You see the A, B, and C sort of genes or alleles shown, and then this middle one is missing, or it gets deleted. So that is interstitial deletion. Types of deletion over here. Cry-to-chat syndrome, again important, again very important in your first and even second year more. Deletion of short arm of chromosome 5. So remember that 5p deletion, that is cry-to-chat syndrome. Incidence is this: clinical features are underdeveloped larynx, hence characteristic cat-like cry. I hope you have, some of you might have heard a cat crying. So that also looks very typical, or sometimes you might get confused whether it's a human baby or a cat, right? It might be confusing. So there is a syndrome for it also, but that is a different thing. A cat, this is a human. So underdeveloped larynx sound may appear like that. That is due to cry to chat syndrome, something related to crying cat on 5p. Remember 5p deletion. And this is Wolff-Hirschhorn syndrome, deletion of short arm of chromosome 4, that is 4p. That is WH syndrome, Wolff-Hirschhorn syndrome. Children mentally retarded and show retarded physical growth. Then there is submicroscopic deletion, very small deletion. Can be visualized by karyotype only. It needs, cannot be visualized by karyotype. It needs fish studies. Remember the full form of fish? Fluorescent in situ hybridization. That was our fish. So these are all the microscopic deletion or submicroscopic deletion. Preferably, these are all the chromosome numbers. Chromosome 15, Angelman, Digeorge, Wilms tumor, William, quite common. Keep on reading them because they will again come in the second day. Pathology. After deletion, we have inversion. Inversion involves single chromosome breaks at 2 points and that gets inverted, and it can be pericentric or paracentric. Now look at the pericentric as well as the paracentric. Again, picture says 1,000 words. It is an inversion. You can see A, B, C, D, E. And this changes to A, B, D, C. So it is pericentric. It is pericentric. That is me around the centromere. C is coming over here and D is coming. This is pericentric. Paracentric means on one side of the centromere only. It is A, B, C, D, F, A, B, C. So this D and E, they get interchanged. Are you getting a point? This is pericentric. That is around the centromere. Paracentric means on one side of the centromere. Okay. Let me give you an example. Like in a school, we have to have, inside a school, if there's a competition, call it as an intra-school competition. And if there's a competition between different schools, it becomes inter-school competition. Yes or no? Inter-school competition between different schools. And intra is inside of one school. I hope you got the point. Again, picture says 1,000 words. Draw this image, inversion. Inversion not responsible for many clinical problems because there is no deletion of the chromosome, no chromosomal material is lost. So that is a good thing over here. Important functional gene is disrupted at point of break, may cause problem, may give rise to abnormal gametes during meiosis one, may lead to abortion. More or less fine. And we have a ring chromosome, we have X chromosome. Let us say ring chromosome. It is a rare abnormality, but yeah, you should know for theory exam at least. Chromosome forms a closed circle or ring, like a ring, simple as that. Breaks near tip, broken and the C. Normally, when it breaks, there is a sticky part. So that gets stuck into distal fragments, might be lost. Again, an image. Look at the image, look at the fragments getting removed. And then these sticky ends over here, they combine and they form this ring chromosome. Sister chromatids exchange during mitosis. Entire chromosome is usually lost and forms mosaics that can be featured. After deletion, inversion, ring, we have isochrome. What we are dealing, guys, is this disturbance in chromosome structure. In number, we have seen already trisomies and aneuploidies. That was number. This is structure. Chromosome formed, isochromosome is chromosome formed due to incorrect splitting of centromere. Splitting results in isochromosome that has two genetically identical arms. There is duplicate of one entire chromosome arm and deletion of the other chromosome arm. Just again, image over here. This is the normal splitting being shown at ABCD. You can see the normal splitting of centromere. This happens. The abnormal splitting of centromere. Just look at the image. Image will say 1,000 words. Right. Okay. I guess we can see a pole also over here. Okay. Let's see one more question. This one might find it interesting. Second question. Let us do an MCQ. An example of a polygenic trait. We have seen initially polygenic inheritance is when there's multiple genes involved. What is the example of a polygenic trait in humans? Polygenic trait. Polygenic trait is when it is determined by multiple factors. Is it a blood type? Is it eye color? Is it cystic fibrosis? That's actually a disease, guys. Or is it sickle cell anemia? That is also a disease of the blood. What do you think? Polygenic trait. Think about it. Just a second. Let me start it again, I guess. Okay. Right. Now I guess the timer has started. Okay. Chalo, fine. Yeah, example of polygenic trait in humans. Blood type, eye color. Second question is this, and cystic fibrosis or sickle cell anemia. The answer for this is option what? Option number B. That is the eye color. So diseases, not disease, but traits like eye color or height of individual or the color of the skin, they are polygenic, determined by multiple factors. While blood type, cystic fibrosis, they are related to simple genes only, mainly cystic fibrosis, sickle cell over there. Okay. Fair enough. Okay, let's move back over here. So we are into this, I guess, isochromosomes. And then finally, we have a translocation. There's exchange of genetic material between two different chromosomes. Either it can be reciprocal or Robertsonian. Remember this word we said in Down syndrome. The reciprocal is translocation occurs between two non-homologous chromosomes after breakage and exchange of segments. That is reciprocal. You can see the reciprocal translocation. Simply you can see the breakage over here, over here, and they are translocated to this. Reciprocal translocation is usually balanced. You can see that. Have no detectable phenotype commonly occurs between chromosome 11 and 22. That is also syndromes. This arises at gametogenesis. Okay. Let us see now Robertsonian translocation. Break at or near the centromere into two acrocent chromosomes. It is break near the centromere. Subsequent fusion of the long arm, short arm of both are lost. So that is simply something different over here. Look at the image. Look at the image. Fragments are lost over here because the problem is around the centromere. Okay. That is the Robertson translocation. Most commonly occurs between chromosome 13, 14, functional balanced chromosomes, reduced to 45. 4% of Down syndrome are due to RT is your Robertsonian translocation. Mosaic. So also, I guess we have introduced a word over here. Most people have same chromosomal constitution in all of their cells. In chromosomal mosaic, two or more cell lines. This is very, very important, guys. Questions have come from MCQs as well. Two different cell lines derived from a single zygote. Okay, two different cell lines of single zygote over here. And let's move over here a bit. In mosaic cells, some of the cells may be normal, others have extra chromosome. Do remember, in individual male karyotype can be, this whole can be the karyotype, right? Okay, just a second. Now, let me see again the poles over here. Okay, let us finish the poles. Okay, just a second. Okay, fine. And then, okay, now give answer for this particular question, third question over here. Bit interesting. Now, epigenetics, question number 3. Just a second. Let me relaunch the poll one second. Right. Okay. Now it has started. Epigenetics involves change in gene expression. That epigenetics involves change in gene expression. That option number A is alter the DNA sequence. Option B is do not alter the DNA sequence. Option C is only occur during embryonic development. Or option D is or are always inherited. Are always inherited. So epigenetics involves change in gene expression. That take few more seconds. Five more seconds. Let us see. Epigenetics. So that's also epigenetics, guys. Epigenetics, do remember it, it will do what? It will involve change in gene expression, but it does not alter the DNA sequence. Answer is option number B over here. Answer is option number B. It does not alter the DNA sequence. Epigenetics might involve some chemical changes in the DNA, but it does not alter the DNA sequence. It can have environmental factors like diet and all that can all play a role for epigenetics. But do remember, there will be gene expression changes, but there won't be an difference in the DNA sequence. That is a point. Let us see a couple of more. Which of the following best describes the role of enhancers in gene regulation? Let me relaunch over here. Okay. Yeah. Question number 4, do answer. Which describes the role of enhancers in gene regulation? They bind to the promoter to initiate a transcription. They increase the rate of transcription when bound by proteins. They silence the expression of genes, or they degrade the messenger RNA after translation. Enhancer. Just imagine the word enhancer, use common sense, that will be enough. Something enhancing something. Okay. Take 5 more seconds. Okay, so guys, the answer for this is enhancing. So answer will be option number B, that they increase the rate of transcription when bound by proteins. That is the role of enhancers in gene regulation. Okay, let us do one more question over here, probably the last one. And just a second. Yeah. So I guess some of you might be knowing that in human genome project, identified approximately how many genes in human genome? 10,000. Second option is 20 to 25,000. Third option is 50,000, or fourth option is 1 lakh. Okay, very good. Yes, so answer is option number B. That is 20,000 to 25,000. 20,000 to 25,000 is the answer for option number B over. Okay. So, okay, good. Fine. So, guys, this was our few MCQs along with the discussion of the genetics part 1. As already said that there is going to be 2 parts of genetics. So one more part will be coming up shortly. Again, I urge all of you to just have a look at the subscription plans over here. And don't look at the practical session now. Why Auricle? That said in the beginning, no practical classes, guys. QBank. Beautifully crafted hard copy notes. Must to have. Doubt clearing session. Exam modules, recorded sessions, live sessions, all is there over here in the Auricle. And thanks for watching, guys. See you soon in the next session. Any problem you can ask in the comment box. So follow our social media handles as well. YouTube, Insta, Facebook, Telegrams, and other. That's all. And yeah, do download the app also. Beautifully crafted app. You can download both on the Apple Store as well as the Google Store. That's all, guys. Thank you for your time. Bye bye. See you soon.